Conversations for Health, dedicated to engaging discussions with industry experts, exploring evidence-based cutting-edge research and practical tips. Our mission is to empower you with knowledge, debunk myths, and provide you with clinical insights. This podcast is provided as an educational resource for healthcare practitioners only. This podcast represents the views and opinions of the host and their guests and does not represent the views or opinions of Designs for Health, Inc. This podcast does not constitute medical advice. The statements contained in this podcast have not been evaluated by the Food and Drug Administration. Any products mentioned are not intended to diagnose, treat, cure, or prevent any disease. Now, let's embark on a journey towards optimal well-being, one conversation at a time. Here's your host, Evelyn Lambrecht.
Welcome to Conversations for Health. I'm Evelyn, and today I'm joined by Victoria and Akash Bhagat, founders of NeuMed Urgent Care and IV Therapy, a fast-growing practice that blends urgent care, IV therapy, and functional medicine in a modern, patient-centered setting. So today we'll be talking about how they're running and scaling their business, lessons they've learned along the way, and of course, we'll talk about clinical care as well. And shout out to Kate, one of our functional medicine consultants in Houston, for introducing us. So to kick us off, what's lighting you both up this week?
As always, I must start with our children. Children and family have been wonderful. We're looking forward to finishing off the summer on some nice vacations. We're going to Lake Tahoe next weekend. Doing a little trip to New England the following. We've been blessed with lots of positive feedback from patients in our practice, and we've been having some good meetings with our providers. So everything's great from a personal health and also from a work standpoint.
I love hearing that. Lake Tahoe is beautiful, and I feel like in San Diego, all the kids have gone back to school. So I love that you're still enjoying summer.
Yeah.
So Victoria and Dr. Akash Bhagat are the powerhouse duo behind NeuMed Urgent Care and IV Therapy. Dr. Akash is a board-certified emergency medicine physician who has launched several innovative ER and urgent care facilities in Houston, bringing tech-enabled and hospitality-inspired care to life. And Victoria is a board-certified family nurse practitioner with over a decade of experience across cardiology, urgent care, and integrative medicine. She's passionate about prevention, hormone health, and bridging traditional care with personalized wellness strategies. Together, they're redefining the urgent care experience. Their clinic model is not only transforming patient outcomes, but also setting a new standard for how functional medicine can be delivered in an accessible, scalable way. That's so awesome. So let's start with your story. How did NeuMed come to life?
Well, Akash and I, we got together. We're both practitioners, as you know, and we both had this similar passion to create something new in Houston. Houston, there's definitely room for improvement when it comes to health and wellness. It's not the healthiest city. We love our community. We've both lived here for a long time. Akash was raised here. All his family lives here. All of our friends live here. But we feel like there was such a delay or kind of antiquated way of the way people take care of themselves and the way that people see their health. So, Akash has been in ER for a long time. I was in cardiology for a long time. We've both seen like the worst and the worst scenarios when it comes to patient scenarios. All the patients that I would treat had established cardiovascular disease, multiple comorbidities, diabetes, hyperlipidemia, and we're on many medications and having several interventions throughout the year. Same with Akash, he would come in with people having acute heart attacks, acute strokes, things that have already occurred in their tertiary or more advanced state. So both of us are very big in our health and wellness journey. We want to make sure that we're optimizing ourselves, having good long-term health, vitality, longevity. We want to feel good. And we know that it's totally capable to feel good. So when we came together, we really created this idea, like, let's create a clinic where it's affordable, accessible. Somebody can come in, walk in, urgent care, treats things from A to Z for illness from head to toe. And we can treat you give you that professional, traditional, conventional approach, but also be more integrated and apply more of the foundations of health, like proper hydration, proper nutrition with the IV therapy, and give you a more well-rounded 360 approach. So we're really not missing anything. And in Houston, we really felt like, man, this, there was a demand for that here.
And when you two first met, were you already both interested in functional medicine, or did you get married and you were both, doing your thing in conventional medicine, and then you're thinking like, okay, there has to be a different way? What was that part of the story?
So the whole functional medicine aspect of NeuMed came about a little bit later. So initially it was, as Victoria said, that conventional Western medicine where you come in for your urgent care. We get all the contracts with insurance companies, and if it's a flu, if it's a laceration, if it's a sprained ankle, something along those lines, let's make sure we can evaluate and treat those patients very well. Alongside that, we incorporated the hydration and nutrition. I'm in the ER world, and at the ER, if you want to come in for a bag of saline and some medication for nausea, vomiting, and pain, you're out pocket, $600-700 for a copay, and then co-insurance, deductibles, etc. You can be out of pocket well over $1,000 just to get a bag of saline and some anti-nausea, anti-pain medication along with that. So what we discovered is there's a lot of complements when you add the IV therapy aspect to just proper medical treatment. So we created, urgent care plus IV therapy under one roof. The functional medicine aspect of it is truly, in our practice, it's more getting the deeper health insights with proper deep blood testing. And alongside that, we can provide better insights into your healthcare for lifestyle, nutrition, and most importantly, supplementation with vitamins and hormones and nutrients. So that's kind of where our functional medicine journey has led us.
Okay. And I'm curious, especially for you, I find it fascinating. Many of the doctors I have met in San Diego, in my territory, who opened their own functional medicine practices, they actually came from the ER, which is to me like the total opposite of, doing longer patient visits and actually, working with someone through a plan for a couple months. I'm curious why that is such a drastic difference.
So as born and bred ER physicians, we enjoy solving problems
Mm.
and we like fixing things. And that's what NeuMed was born out of. It was born out of my passion for um, solving problems and fixing things. So I saw a big problem, at least here locally, with the healthcare system and the overall offerings. So I saw that problem. I wanted to fix it. So we created NeuMed, and that's with myself and Victoria's minds put together literally over dozens of dinners on the back of a napkin, and then perfecting the concept, and then incorporating into our first brick and mortar location in the Heights. And the concept was embraced by that local community, and then we expanded from there. I think the parlay into functional medicine for a lot of doctors, because they see that the tradition, sticking to purely traditional medicine, writing a prescription, doing some basic blood work um, that's recommended by the American Association of Family Practitioners, or ultimately it's by, a lot of times it's by studies funded by either big pharma or insurance companies. We got to think outside the box and do a little bit more than just what's recommended by these larger entities. Let's do our own research and find out what other biomarkers we can look into, and what do those mean for our health, for our wellness, for our longevity. And how can we pick up some of these chronic diseases, inflammatory states at an earlier stage in life, so we can avoid getting on those medications or avoid those surgeries and avoid those hospitalizations or illnesses by getting these better, deeper insights earlier in life on an elective basis.
So, what does this actually look like in practice? So, I mean blending in the functional medicine into an urgent care model. So, is it like if somebody comes for, they have a cough or something, then you might recommend more nutritional immune support? Or if somebody comes in with, say, an ankle sprain, you'll treat the ankle and do all the things that would normally be done, but then you might also recommend some sort of anti-inflammatory herb formula. Is that kind of how it goes?
It is very similar to that. So say somebody comes in, has like upper respiratory symptoms, are feeling really fatigued, they have fever, they have cough, you test them, they have COVID or something like that. It's a very easy thing to say, hey, are you supplementing with anything? Let's introduce the conversation of like the nutraceuticals. Vitamin D is the gold standard for proper immune function. So really none of those patients should be leaving the clinic without a vitamin D shot. It is just as powerful as like giving a prescription medication. And many times a lot of these people come in and they have a virus, which is not going to be benefited by any antibiotic, but we have grown into this culture where everyone expects to have this pharmaceutical medication or pharmaceutical intervention for it to feel like you're getting treated, or that, that's what you need. When a lot of times we've kind of lost ourselves in all of these synthetic things, where let's just go back to the foundations. Like when COVID was really hot, there was so many evidence-based, peer-reviewed articles showing, hey, everyone needs to be supplementing with vitamin D, zinc, and vitamin C. These are going to have a more notable impact in your recovery and symptom relief from COVID than any prescription medication. But yet you still saw all these patients like going through great lengths to find ivermectin and all of these other things. And it's because we've been kind of trained throughout decades that Western medicine has trained us to be more pharmaceutical and intervention based, rather than, hey, there's so much we could do with a more conservative, natural approach that has really powerful effects. And so that's where we come in, and we wanted to be able to introduce both of them because we see the power and the benefit in both. But we do think there's a disservice when you're just focusing on one thing, conventional, traditional Western medicine, and you're not considering more of the pillars and foundations of health. And that would be the nutraceuticals, supplementation, et cetera. And then, if you want to be more on the other side, like we have people come in with migraines or stomach bugs, they're having nausea and gut irritability, getting an infusion with Pepcid, with Toradol, with Zofran. These are strong prescription strength anti-inflammatories, anti-nausea medications. That person's going to walk out like feeling 10 out of 10. Where otherwise they would have really had to go to an emergency room, wait 4 hours in waiting lounge, and then go home with like a $3,500 bill to get that. So we're able to offer that walk in, affordable, accessible. Yeah.
So I'm curious, do patients come to you because they've heard that you are more integrative, more functional, and so they're like, oh, that's the urgent care I want to go to? Or is it like they search for an urgent care and then they come and then they're pleasantly surprised maybe when you have these other options?
I think it's going to be both. We've got a great reputation in the Houston area. We've, if you search us, we've got, 4.6 to 4.9 star rating on Google. A lot of people love us. We've got, a high amount of repeat patients as well. And we're blessed and lucky to have that. And that's by design. We try to create a culture where we hire the right providers, and we offer them a facility in which they are they're understood, they're listened to. Any concerns they have, we take action based on that. So we provide an excellent environment where fantastic providers like to stay and work, and that type of loyalty also provides, that type of that personality rolls downhill. So when patients come in, they see providers that are happy, they're excited, they're not depressed, they're not overworked, and just treated like another cog in the healthcare spoke. So that excellent experience for the patients leads to a loyal customer base. So that's part of the equation. Patients do come in a lot of times, hey, urgent care near me, let me go to NeuMed, they've got a great reputation, let me go in. So they come in and they tell us, hey, I'm feeling tired, but I also have this fever, chills, headache. So we can test for some of the bedside testing for strep, flu, COVID, do a urinalysis, do a lot of these tests, send off some blood tests also. But then we also have the luxury of having a little bit more time where we can educate the patient, hey, there are some other things that may be causing your fatigue. There are some extended blood panels that we would like to run. Would you like to do that and get some deeper health insights? Like, oh, yes, absolutely. Tell me about that. And since our providers know about that, and that's a service, and that's a discussion that we can have. Subsequently, we're able to give them, some IV fluids with some vitamins, B complex, B12, a shot of vitamin D, some glutathione, vitamin C, a lot of these nutraceuticals, which there's a ton of evidence-based research out there that shows that there is a lot of benefit for these vitamins given the use cases that we dispense them for. So patients are able to come in and not just get the prescription for their antibiotic or antiviral or anti-inflammatory or eye drops for their infected eye. They can have a little bit more of an in-depth conversation about their health, about their wellness. And then there's the other side of our company that also does, the IV fluids and the vitamin shots. And then we can offer those deeper insights using, laboratory testing.
I just had quite a few questions come up
Of course.
based on your answer. So you said that the visits are a little bit longer. So I was curious how that works because I know that you accept insurance. And another question that came up for me is, how have you trained all of your staff in this? So we'll go do the first one first.
No, a great question. Are there times when people come in and they're in and out in 15 minutes? Absolutely. But our providers do know that, if someone does need the extra time and extra counseling, then especially if we have the capacity to continue and educate that patient, try to educate every patient on their health concerns and make sure everyone leaves empowered with knowledge so they know more about their either disease state or symptoms. And so they also have a plan of care once they walk out.
For the provider training, it does require a lot more outside of what they got in their original training. So that's where I come into play. And then I have other lead nurse practitioners that I hire and that I train for these particular positions. So we're just continuously learning. We have a monthly provider call where we all log in and we all talk about everything. We also have a team portal, which we call Team NeuMed, and it's a communication thread where we post all our policy, procedure. Everything is very organized within each category space. So for example, Functional Health Labs has its own category space with all of its content, all the information needed there. Same for iron infusion, same for NAD therapy. So we have to stay super organized and we have to stay very up to date with what the evidence-based research is showing. And we all took that oath when we decided to become practitioners. The constant learning is lifelong. And so we all have that personality where we enjoy it. We're always looking for it. So it is just constant conversations. It is a big role of mine in the company to be that advocate for the nurse practitioners, for our providers. And that's a big part of what I do. Is just, I every week I go to different locations. We sit one-on-one. I'm open communication. They can call me, text me anytime. But yeah, we do provide very robust resources on a Team NeuMed portal. That's all very tech savvy. It was built specifically for our company.
Nice.
Now, Evelyn, that's an interesting question. I want to give another comparison. We would onboard not just healthcare professionals or nurse practitioners from other companies, but also LMRTs and MAs. And, one of them brought us a training manual from one of the other urgent care centers. And it was literally a 400-page binder with screenshots of the software showing them where to click and how to document. In today's digital age, that's just such an antiquated teaching tool. So actually, initially, we brought on some folks that had extensive experience in technology and in some of the computer programming. So we designed a proprietary communication training platform that's our own, which we can put training videos and documents on and disseminate it to all locations all at once, put a little update to drive our providers' attention to those training documents, and they read them right there while they're on site. All of our NPs have two large screens, one for the documentation software and another they have our Team NeuMed portal so they can continuously be trained while they're working. So it's a constant state of educating and updating our NPs on what's the latest and greatest.
That sounds very fun, fast-paced and fun and always learning. And I think that's one of the most beautiful things about this field is there's no shortage of things to learn. And there's just so much knowledge being added like to the field every single day.
Right.
Progressive. Yes.
So you guys have grown very quickly. What are some of your strategies that you feel like have helped you scale successfully while maintaining that quality of care?
Surrounding yourself with the right team, I would have to say. We've made mistakes. What we try to pride ourselves on is trying to figure out those mistakes quickly and be solution oriented, and think practically and logically and not emotionally, and try to find the right people to put in the right roles. What we've learned is you can have something that's someone who's a fantastic human being and excellent at a job, but if you put that same person in the wrong role, you're just setting them up for failure, no matter how many tools you give them. So we try to put our employees in roles that they're passionate about, educated within, and have a strong background, in order to succeed in that role. So I think that's been key in getting us to where we are right now.
Mm-hmm. And also just staying in close communication with the staff that you hire and constantly getting feedback and doing like friendly audits, basically like checking in with everyone, and seeing how you can further streamline the process. What are friction points? What is working? And constantly revising, constantly improving. So we are just always on the lookout. It's definitely like, hey, we implement it this way and this is how we're going to do things. A year passes by and then we're like, hey, how's things going? Absolutely not. We do constant and frequent check-ins. So I would say that is also key to our success.
One of our phone calls, what we would call it wasn't like a check-in with the staff. It was roast the leadership. So we wanted only what we were doing wrong. So we constantly were soliciting for improvement.
Constructive feedback.
Constructive feedback, yeah. And we weren't looking for fake compliments. We wanted them to give us the good, bad, and the ugly. And they started with the ugly, and then, of course, if there's some positive, we would get that also. But I think as long as you're the key individuals who have their hands on our patients, as long as there's an open line of communication from them to you, and you're getting direct feedback, then there's plenty of room to improve and stay ahead of the curve when it comes to running an up and up shop.
I love this. I'm curious, what are some challenges you guys have faced? And I'm especially interested with you guys being married and running a business together. How does that work? Because even I've seen this many times over the years where it's even, friends who open a practice together and at some point, they decide to go their separate ways. And so I'm curious, do you kind of keep that separate? Or do you guys have any rules around not talking about business at home? Or is it all just like work-life integration?
Work-life integration. We wake up and it's like, hey, I had this idea. Or in the middle, like we're putting their kids to sleep and laying there while they're drinking their little bottles. And we're like, what do you think of this? Like it's a constant, and neither one of us get overly fatigued or annoyed or frustrated by it with each other. We just are always constantly bouncing ideas off each other, and just a good night's sleep and waking in the morning, and it's like a whole new conversation, and we've kind of already redirected from the night before. It's just how we operate. And weirdly enough, early on, I remember feeling a little nervous about that. Like, man, I don't know if, I've heard a lot of stories about people working together, husband and wife. I'm scared what this is going to do to us because we have such a great friendship and such a good relationship and we love being around each other all the time. But it's never been rooted in business, and business is, it's business. But surprisingly enough, we do very well. We work very well. I think we have, since we created NeuMed together from inception, and we've had the same goals and the same vision. As we've built it, we're just supporting each other and continuing to strengthen the concept. I will say we are, though, very different in the way that we approach our business. I cannot do what he does. And he can't do what I do. So that actually brings us a lot of harmony because I kind of take over some things that he just genuinely doesn't have in him. And then he's got the entrepreneur, the big vision. He's risky. He's like, let's do this. And like, he starts putting things into action. And I'm like, I would just have a panic attack if I were on my own to think about those things. So then I'm just like, okay, like if, you're confident in this is what you want to do. Like, okay, let me do like the nurturing and the policy procedure that it's going to take to really actually implement that safely and accurately and get everyone on board. So I start thinking about the other steps that it takes to actually make that happen successfully. So I think the fact that we are so different in our skills, our business skills, makes it a good thing. I feel like if we were both strong in the same thing, we'd probably clash. So we have that going for us. Yeah.
That's great. And what are some of the challenges you've encountered over the last few years?
Oh my God, so many challenges. Akash, which challenge would you like to start first? Insurance?
Yeah, first and foremost is insurance. Didn't realize how difficult it would be to negotiate decent contracts with them. How influential they are on our consumer's mind. How a lot of patients take ownership over their insurance company and don't feel like they have an actual relationship with their healthcare provider. So it's that learning curve where we didn't realize how we knew the insurance companies were powerful. We didn't realize that they are this influential in a person's decision making. So people will come in and say, "Well, I don't want my insurance company to be billed for that." Well, you're paying $800 to $1,000 a month, and you don't want your insurance company to be billed. You should want and you should say, "You are my doctor. You are my urgent care," and it's the insurance company. But it's like taking that ownership of, they feel it's like they are their insurance company, when in actuality, insurance doesn't always care that much about their insureds. I'm sure they want to do the right thing in many situations, but it's the doctors, the nurse practitioners, the MAs, the folks that have their hands on the patients, that have the patient's best interests at stake. And I wish that sacred relationships between healthcare providers and patients could be more popular than they are now. So I think that's been the biggest challenge, kind of proving to our patients that we are actually looking out for their best interest, while we're also, of course, trying to run a business and keep all of our employees paid properly.
To give two examples about insurance, like for one example is it took over a year of being open to even become in network with our first contract, our insurance.
Wow.
And it's because they will push it back just to add another month delay after another month delay. And it can be such tedious things. You have to call them constantly. You're constantly being redirected to a different person, and each different person asks for different things. So even after you've satisfied all of their requests, they'll send you to another representative, which will have completely set of new requests and then further delay things. They're very strategic in that. They love to confuse people. And just to delay things in their favor. So for over a year, we were out of network, and it took an incredibly long time to become a network. And I think starting this business, we were very naive. We knew that insurance companies were manipulative, and I find to be quite fraudulent, but we didn't know to what extent that they were. Another example is insurance companies, for example, over the last, especially couple of years where we've seen inflation and a lot of economy changes, we've had our staff, labor costs go up. Our staff costs have gone up. Our supply costs have gone up. Our facility costs have gone up. And insurance premiums have gone up. Insurances are charging their patients more for the same things because of inflation. But they have not made any changes to the reimbursement that they pay their doctors. So anyway, that's just a little interesting too. But that, I would say, is one of the biggest hurdles, is the insurance companies. Second to that is, I think, just the big players in the healthcare market. In Houston, we've got big players like Methodist and United Healthcare. And when you're the new kid on the block, you're kind of an underdog. You have to really prove yourself and establish yourself and your worth and verify that you are like providing good standard of care, where all these other companies, that are very large and have been established for a long time, have grown and established themselves. So you also have that really solid competition. And what would you say, Akash, would be another challenge that we faced?
No, I think you hit the two big ones. It's more just external forces. The team has worked very well with each other. We've brought on smart financial advisors also recently to help us get to the next stage. So everything internally is going fantastic. Yeah, just dealing with insurance companies, negotiating those contracts. That's just something that it's tough to deal with, especially when to a certain degree, insurance companies, they're our friends. They pay bills. And we rely on them to compensate for us taking care of their insureds. But on the same token, I do wish that there was some better ways where we could get compensated the same as someone else providing the same service, as opposed to, hey, this other person is a large institution, therefore we're going to pay them 2 to 3 times the amount that we're paying you, even though you're providing the exact same service. You have the same type of trained providers, but since they have more leverage, then we just don't get the same deal. So that's really it.
Yeah. It's wild with insurance. And I think that's why so many functional medicine providers, they just start a cash-based practice or a concierge membership. But to me, we still want things to be accessible for people, right? So if, like you're saying, they're already paying for insurance because we need it for, worst case scenario, then we want some of that money to actually get us some benefits. So I don't envy you guys.
Yeah, we've come up with some solutions, Evelyn. We actually created our own membership model where, for $129 a month, they can come to us as often as they want. They get all their diagnostics, all their testing, their prescriptions, their shots, everything covered for $129 a month. And honestly, that covers about 80% of what people need on a regular basis. And for, I think it's $59 or $79 a month, they can come in as often as they want. They get all the diagnostics covered, and they just pay a $75 copay to us. So we offer some solutions for those people who want that peace of mind, and who are saving that, $400 to $1,000 a month on insurance premiums. And they want something where it's predictable, where they're not, getting any surprise bills, which we're also extremely transparent about our costs. Where we've found problems, we've implemented solutions for our patients.
That's great. You have mentioned the diagnostics a few times. So I'm curious, what are some of your favorite tools to use in practice for that aspect?
Well, when it comes to more of our wellness, our favorite diagnostic right now would be the functional health labs. And when we say functional health labs, essentially what that means is just comprehensive panels. It's going to be far more than what you get at your annual physical. So this is going to test for vitamin and nutrient status. This is going to check for adrenal health, hormones, inflammatory biomarkers, cardiovascular risk factors. Like, instead of just your lipid panel, will also add some like genetic risk factors or inflammatory biomarkers that we see with people who have heart disease, like homocysteine, CRP, lipo A and B. And then, like vitamin D and magnesium and B12, things like that, that are not routinely tested. And then a very comprehensive hormone panel. So this is going to just give you just a much bigger picture of where you are objectively, especially for those who come in and they're like, man, I've gone my annual physical every year. They say everything looks normal, but I still don't feel good. I feel sluggish. I have brain fog. I have frequent migraines. I feel like I get sick too often. It takes me too long to get better. I'm young. I don't know why I feel like, I feel like I should be feeling better. That's such a common complaint that we hear. And the reason why many times this is so common is that our standardized blood tests, our parameters are extremely wide. They're graded from the lowest functioning human to the highest functioning human. So a lot of times you'll see parameters that are like normal is 5 to 250. If you're anywhere in between there, you're normal. That's just crazy. So year after year, people are just saying, okay, as long as it's within this normal parameter, I'm good, I'm good, I'm good. Years go by, the next thing you know, they have some kind of event, like a stroke, or they have full-blown hypothyroidism or something. And they're like, well, everything looked normal. I've been to the doctor, and just suddenly they just have this disease state that now requires pharmaceuticals and medical interventions. So the point of functional medicine or more comprehensive blood testing is to be able to test those parameters become much more narrow, much more strict, and the parameters are tested are compared to optimal thriving individuals. So you're not going to have this huge parameter from 5 to 250. It's going to be more like, 100 to 200. So we're being very strict and more narrow on that parameter. Like if it were me and I'm going to get comprehensive blood testing, I don't want my blood compared to the lowest functioning human being that ever existed. I want my test to be compared to thriving optimal individuals because that's how I want to feel and that's where I want to be. So I want my blood work tested compared to that. And so that's what that does. So I recommend functional health labs to every patient. I think everybody should be getting comprehensive testing once a year, or that's the bare minimum that you can all be doing for your health. It's the greatest investment you can do. If you could just refrain from the Starbucks coffee or buying that designer handbag, like invest in some functional health labs. Every single person could benefit from that. Everyone is different. There are some people who are more progressive and more interested and proactive in their health and are going to really seek that out and request that. And then there are others who really just want to get labs that are covered by their insurance. And that's where there's just that education that goes into it. That's like, hey, annual physical labs are really just the bare minimum, and this is what it's going to tell you. There's so much more to the story. There's so much more to what makes you up. So we're here to advocate and educate on that. We are working on making them more affordable. I think that's been probably our greatest barrier is patients are like, man, it's expensive. It's like, yeah, everything these days is expensive. And like, the truth is these labs are expensive. Like they're not cheap labs. So it's not that we purposely make these panels pricey. But I know that we are working diligently to see how we can lower the cost to make it more accessible to patients because it is our passion to make our community healthier. And so that was a big part of our concept was NeuMed was meant to be this affordable, accessible place for patients to get better care. So we're hoping that we just launched it now, like 2 months ago. So over time that we can find ways to be more creative to make it more affordable.
Yeah, let's talk a little bit about supplements. So I'm curious, do you carry certain supplements in all of the locations? Are you sending people to your online virtual dispensary and utilizing like an e-script recommendation? How does that process work in your practice?
Yes. So supplements are a big deal. We do have a virtual dispensary with Designs for Health. We did choose them because they are very high quality. They are vetted. They're clean. They test their supplements. That's a big question that comes in through our doors all the time. It's like, hey, I want to take this supplement. Which brand do you recommend? On like Instagram and TikTok, patients are fed so much information. We have influencers with no medical background pushing a certain supplement because they're going to get some kind of financial incentive on the back end. And it's dangerous, really. It's so scary. So we're like, hey guys, really supplements are not created equal. It is super important that you go with like a trusted source when it comes to that. It's something that you're putting into your body daily and you're trusting that it's going to have a positive output. So quality matters, where you get them matters. We have the virtual dispensary where you can purchase kind of like on your own, kind of like an online shopping experience. And we do carry some supplements in-house, 9 different ones. We chose some of the more common ones that we see, like probiotics. We have a hormone optimization supplement. We have some supplements that are really good for calming anxiety and balancing the central nervous system. So we have a good variety there in-house, but if you want to shop more broadly, then we do have the online dispensary with Designs for Health.
That's great. And I'm curious, we don't always talk about this, but since we are the Designs for Health podcast, but I'm curious, how do you feel like Designs for Health has supported your clinical and your business vision?
It's been very well and very easy, honestly. It came pretty opportunistically because it's exactly what we needed and what we're trying to do. So when we got connected and the more and more we learned, the more and more we were like, hey, this is like kind of like a piece of a puzzle that just fit perfectly and created our experience to be more turnkey and very easy. So I would say that it's allowed us to really streamline our recommendations and our patient care, like our patient treatment plans, because now we have like a trusted source. Like, hey, here's this online dispensary, click this link or follow this QR code, and it takes you straight to the source with all the options available. We can create custom links to patients directly for their exact supplementation plan, where they can just click that and they're all right there and they can just purchase them. So it eliminates like option overload or which type of magnesium. There's 3 different types, which one? So we can make those direct recommendations for them and make it super easy. So it's been great adding to our practice.
I love hearing that. And I love, like, my practitioners love using the eScript option. It's just made things so much easier since we've had that the last like 2 or 3 years. So that's awesome. So I'm curious, what's next for NeuMed, like in the next, 1 to 2 years, but then also in the next 10 to 20 years?
we have plans. No, just go.
Yeah.
Akash, you want to talk to us about those plans?
Yeah, well, we get approached by not just patients but providers and folks who are just excited about the business concept that we've built. So we're looking into various strategies to expand currently, and some of that includes some strategic partnerships with smaller healthcare systems as well as independent business owners. So whether that's via joint ventures or franchise type concepts. Over the next couple of years, you're going to see some pretty exciting rapid expansion of NeuMed throughout Houston, into Austin, Dallas, San Antonio, and probably outside of the state as well. So more on that in the future, but we've been having some excellent discussions.
That's really, really exciting. And what do you hope ultimately, like, is your legacy with NeuMed?
We've always thought that NeuMed would be the clinic of the future. So not only are we trying to incorporate, we definitely don't want to be AI run, but we are interested in incorporating technology in order to more efficiently run our practice, to streamline the patient experience, to enhance the patient experience, to minimize documentation errors, maximize communication, and also just to provide like more time between the provider and the patient. So if we can lean on machine learning to take some of the redundancies out of our work, so we can concentrate on more of that sacred provider relationship with the patient, then that's what we're working on right now. And we want to be the first to market to do that because we're small enough and nimble enough to be able to do so. So we want to be first to market and do that best.
But also, NeuMed, I wanted NeuMed to really be like set the tone for a new health standard. Like, I feel like all clinics in all specialties should be incorporating and integrating more health and wellness in their treatment approach. And since we saw a big gap and that didn't really exist. That's why we created NeuMed in the first place. So I see that people are caring more and more about their health and being proactive and wanting to like investigate and learn about themselves and not just wait for a problem to occur to start asking questions. So hopefully this eventually becomes more the standard of care, in the next 5-10 years. every clinic has, like, yes, we have our Western medicine, we have our pharmaceuticals, our interventions, but we also have that nutraceutical foundation too that we integrate into all of our patients' care.
Yeah. And speaking of the foundations, you mentioned in the beginning that your providers do talk to your patients about some of those lifestyle changes. And I'm curious, do you have any like nutritionists or health coaches, or do you run any group programs like group detoxes or group programs that encourage patients to come in and like learn together on those foundational aspects of health?
I love that. We don't have where we have like routine or scheduled learn sessions or anything like that, but we have partnered with different like lifestyle medicine coaches. One of them is Verified Wellness. She was born in Houston. She's lived her whole life here in Houston. And so essentially she's like a GLP-1 specialist. She will hold your hand and walk you through. So she'll get the objective data, look at the functional health results, have a one-on-one consult, and then be able to give you actionable ways to implement change, because sometimes it can feel very overwhelming, and we get several for somebody to have several things come at them and they're like, oh my gosh, they feel fearful, they feel their health is so bad. And it's really not that. Sometimes it just takes some educating and breaking it down and having somebody educated in that to kind of give you the first few steps to get you started. So we do partner with people who do that. Yeah.
I think that can be helpful too, because I believe that you can get insurance reimbursement for group sessions like that. And I think it really helps because then it allows the providers who provide the licensed providers who provide the medical care, they can focus on that higher level care, right? Versus some of the foundational stuff. So, cool.
Yep. Yeah.
What would you tell other clinicians who want to practice in this way, but maybe feel a little overwhelmed and unsure where to begin?
There's definitely a lot to learn. There's a lot of resources out there. It does take a lot of self-motivation and desire to learn and understand more about the preventative aspect of health. Getting some partners so you can lean on other people's expertise. Folks like you guys over at DFH have been wonderful in sharing resources and getting us plugged in with other folks in the industry also. So getting that really good personal foundation, surrounding yourself with a network of folks who can assist as you grow has been fantastic. Because when you have a really solid network, then you're part of a bigger group of trusted professionals, and you're not just a solo provider out there trying to do everything on your own.
Yeah. Surrounding yourself with like-minded business entrepreneurs who are, have the same goals in mind, or you can even shop your inspiration and go to places that are doing things that you're doing at a higher level and maybe experiencing it firsthand and seeing what you like, pen and paper, write the things you like, the things you didn't, and see how you want to personalize your experience if you wanted to do something similar but different. But yeah, it does take a significant amount of educating effort, and then also a lot of risk.
Right.
You've got to be willing to take on a decent amount of risk, especially in a city like Houston, because there are more progressive cities out there that are, like a few steps ahead of all of us. I'm grateful for the wellness world here in Houston that is really trying to make a difference in our community and making our community healthier and to educate. But I have found that it takes a lot of repetition to educate patients on health and wellness just because they didn't really grow up learning it. So they're just kind of learning it for the first time.
Yeah, excellent point. And how wonderful that you do get to do something like that in a city like Houston.
Yeah, that needs it,
Yeah, absolutely. So, okay, we're going to wrap up with my signature questions that we ask every guest. So it's just kind of rapid fire. And Victoria, I'll start with you. What are your 3 favorite supplements for yourself?
My favorite supplements right now, well, I've been taking consistently is vitamin D, holy grail. Cannot compromise on that. That's the gold standard. We all need to be supplementing. So vitamin D acts like an antioxidant, great for immune health, recovery, but great for boosting your mood. Second one would be CoQ10. CoQ10 also acts like an antioxidant, great for oxidative stress, energy, endurance, DNA and mitochondrial repair. It's also like a non-negotiable if you're of childbearing age and trying to, make sure you have good reproductive health and wanting to conceive. It promotes good egg quality. So that one, and the last one would be NAC, or N-acetylcysteine, which is the precursor to glutathione. As we age, I'm 35, our glutathione stores start to progressively decline, which leads to natural aging. But we don't have to let that take full course. We can supplement to slow that down. So I do it.
Great. And Akash, what about you? What are your 3 favorite supplements?
For me, 2 of them are the same as Victoria's, and NAC and vitamin D. Vitamin D for all the reasons Victoria said, and then I love my probiotics. I've noticed that I feel better when my gut health is in check, and healthy gut leads to just decreased overall body inflammation, and I notice I feel better. I have more energy. My mood is a little bit more uplifted also when my belly feels light. Yeah, those are my favorite ones.
Great. And Victoria, what are your go-to health practices?
To keep me happy, I need 2 things every day. I need my skincare routine. Okay. I need to be able to have 10 minutes to apply the different layers of my serum and my sunscreen and feel fresh. And then secondly, I always want to get at least a 20-minute brisk walk outside. That is what keeps all those stagnant thoughts, all of that, those to-do lists in my head that kind of run a little haywire. When I'm walking briskly outside and like multitasking and looking at the trees and the fresh air, for some reason I'm able to sort everything in, and I find the solutions to all those heavy thoughts that I have been carrying throughout the day. So non-negotiables.
And Akash, what about you? What are the health practices that keep you energized?
Yeah, one of my favorites, as Victoria said, I love spending time outdoors in nature, especially when the weather's favorable. I do that kind of in a meditational type fashion. I love my high intensity, the HIIT type training. So I enjoy that a couple times a week. And whenever I can get in a hot yoga, or at least some decent type of yoga session in, once or twice a week, always gives me that mental reset and allows me to feel like I can handle all the problems that I may have. So it just kind of clears my mind.
Wonderful. And last question for you guys. Victoria, what's something you've changed your mind about through the years?
I would have to say the biggest one is how the annual physicals. It all starts with that preventive care. Since I've been in cardiology, all the patients I've ever treated have multiple comorbidities, are super ill on multiple medications, and are functioning like a 90-year-old at the age of 65. All of those things could have been prevented. It just took some more deeper insight and knowledge earlier on. So I think starting at the age of absolutely no later than 30 years old, take your annual screening very seriously and invest in more comprehensive blood work. Start there, and then that can save you a lot in the future.
Yeah, I think that's an excellent reminder, even for us as healthcare practitioners, right? Because we're all so busy taking care of others that it can be easy to neglect our own health as well. And Akash, what about you? What's something you've changed your mind about through your years in this field?
I no longer take any one person's opinion or advice when it comes to my health. So I do my own research. I look at various sources. There's a ton of misinformation out there. I would never jump on the first trend that's out there either. Let time do its thing and vet out what's effective and what's a hoax. don't listen to AI about everything. AI has hallucinations
Yes.
and creates things when they're not true. And we definitely don't want to rely on AI type tools to give us all of our health advice. So that's kind
Excellent
of where I am right
reminder.
now. It's an excellent tool. Yeah, it's an excellent tool, but check sources on everything.
Absolutely. Yeah. Thank you for that reminder. Well, thank
You're
you
welcome.
both. This was wonderful. I really enjoyed this conversation with you. And I wish you both the best of luck as you take NeuMed into the future.
We appreciate it.
Thank
Thank you, Evelyn.
you. Yeah, we're happy to be on. Thank you.
Thank you so much. And thank you for tuning in to Conversations for Health. Check out the show notes for resources from this episode. Please share this podcast with your colleagues, follow, rate, or leave a review wherever you listen. And thank you for designing a well world with us.
This is Conversations for Health with Evelyn Lambrecht, dedicated to engaging discussions with industry experts, exploring evidence-based cutting-edge research and practical tips.